If you want to start, I mean, just tell us a little bit about your work at Riverside.
Radiation oncology department. I see patients once they've completed their treatment. So I see them usually for several years after completion of therapy for all types of cancer. We treat obviously skin cancers, but we treat a lot of other malignancies as well here. So that's my role in the health system.
And thank you for talking about this. I mean, before we started, I said, there's been so many personal stories in planning this conversation that have been
Sure.
shared. And you hear everyone, bring up maybe a story of their family or their friend or something that maybe worried them. I mean, just to
Right.
start, could you just say, what is skin cancer? I know there's different types and, sort of
Sure.
maybe the umbrella.
So, skin cancer is, the most common malignancy in the U.S. And there are multiple types of skin cancer, and it is essentially a damaged cell somewhere in the thickness of the skin that has become malignant due to damage, typically from UV radiation. And the three primary types are basal cell, squamous cell, and melanoma. There are some other, more obscure types of skin cancer, but those are the three big ones that we see. And, the melanomas tend to be the most concerning. They act most aggressively. They have a higher propensity to spread to lymph nodes and even distant organs in the body. So those are the three big types. Overall, we divide them into non-melanoma cancers and melanoma cancers. Melanomas are tracked in the cancer registry and are actually the fifth most common cancer in the U.S. for for 2022.
And I think some people think to look for, maybe an interesting freckle or something of a
Right.
spot. But, are there other sort of things that you need to look for? Because I've also heard of, having something that might look like a pimple that doesn't go away and those sorts of
Right.
things.
Right. The general rule of thumb is anything new on your skin or anything that is changing. So it looked a certain way for years and now it's beginning to evolve and look different. A lot of people think of the ABCDs, which is a good rule of thumb. Lesions that are asymmetric. So if you divided them in half, one half looks different than the other. Lesions that have irregular borders, sharp or angulated borders. Are concerning. Variations in color within a mole or a lesion, where some parts are brown and some parts are pink or fleshy colored, is a concern. And of course, diameter, so something that's growing and becoming larger. And generally, we talk about it, the diameter bigger than a pencil eraser. But the big one, the E, is anything evolving. So if you have something that has looked a certain way for years and, it's changing, it's crusting, it's, like you said, beginning to look like a pimple, or it becomes more of a sore that won't heal, all of those things should be checked.
And is the best way to check yourself for that? Is it just going to, other doctors? I've heard, even going to the dentist is so important just to see if you have anything growing on your lips or your mouth. I mean, how important are all
Sure.
these doctors' visits?
Sure. Well, often the best place to start with a new skin lesion is the primary care provider. There are some benign lesions that can look pretty scary, and the primary care provider can immediately look at them and say, that one's okay. From there, if the primary care provider believes it's concerning or is unsure, some of them will do biopsies, but many times they'll refer you to a dermatologist to do a full evaluation.
And how important are those skin checks every year? I think, some people make that a priority, whether it's in your hair or whether it's finding something on your foot. But how important is that yearly check?
It's very important, particularly for patients who are at higher risk for skin cancer. So, our patients with very fair skin that almost always burns and doesn't tan well, that skin type, they have a higher propensity to develop skin cancers, particularly as they age. People who have a lot of UV damage to their skin should be checked definitely on a yearly basis. Certainly anyone with a history of prior skin cancers, and that's a big one. We see patients who have had several skin cancers, but yet they're not going for those skin checks on a routine basis, and they really should be, because if you've had one skin cancer, you're at risk for more in the future. So, and then, some we don't think of, patients who are chronically immunosuppressed, whether they've had an organ transplantation or, they're on chronic immunosuppression for an autoimmune disease, have a higher propensity to develop skin cancers. So, it is important, particularly if you know you are at high risk, to get checked on a yearly basis.
And what are those things that might put you at higher risk? So you just said, maybe prior skin cancer, but then,
Right.
are there genetic things involved?
There are. So a family history does make you more prone, and that may be because, if you have a family history of skin cancer, your mom and dad maybe were fair skinned and burned as well, or maybe it's that, you're a more active family, so you have more sun exposure. But for whatever reason, a history of skin cancer in your family does increase your risk. And then there are some genetic syndromes that put people at much higher risk for skin cancers. And those are a little bit more unusual. But, if there's a strong family history and a patient has had multiple skin cancers, referral to a geneticist is sometimes recommended also.
And, I'll give myself as an example, but, spending so much time outside, whether it was sports when you're younger, whether it's going to camp, going outside to play. I mean, how much does that have an impact?
So your cumulative lifetime UV exposure is one of the main risk factors for skin cancer. We talked about fair skin, but that UV exposure really is one of the biggest links with your likelihood of developing skin cancer. So, for instance, patients who are in occupations where they have a lot of UV exposure are at much higher risk. Patients who live near the equator. So the closer you are to the equator, if you have fair skin and you live at those latitudes, you're going to be at higher risk. So that cumulative exposure is certainly a big risk factor for skin cancer.
Right. And that I was going to bring that up with, lifeguards right now, whether it's the pool, on the beach, people that do have work outside.
Yep.
I mean, are there ways to mitigate that, whether it's, certain, I've heard of UV shirts and I've heard of, certain sunscreens, but what are some ways if you do have to be outside, especially this summer, to, help protect your skin?
So UV protective clothing is an excellent way to protect your skin. Of course, you have to be cognizant of the areas that aren't covered. So just because you have a long sleeve UV protective shirt on, you still need to use sunscreen on your face and hands. But that is an excellent way to protect yourself, particularly if you have an occupation that requires you to be outside for long hours during the day. Sunscreen is a good way to protect yourself, and we recommend SPF 30 or greater. An SPF 15 sunscreen will block about 93% of the damaging UV rays. And if you go up to a 30, you get up to 97%. A 50 gets you to 98% blockage. So sunscreen is an excellent way to protect yourself as long as it's being applied correctly. And, those are the two big ones. Obviously, seeking shade, trying to avoid the worst hours of the day between 10 and 4. All of those things are helpful.
And I've heard people say, they put sunscreen on, whether it was, spray in the morning before they go in the water or, before they went outside. But then the reapplication is so important, right?
It is. The initial application, in most studies that they've, where they've looked at application of sunscreen, most people just don't use enough. The general rule of thumb is that you should be using a shot glass full of sunscreen to cover the body. So that's the number one, is that the initial application, you really do need to use enough. But on the reapplication side, every 2 hours is the general recommendation, unless, if you've been in the water and you've been really sweating when you come out or when you dry off, you need to reapply then as well.
And, we said, higher SPF, but in terms of nowadays, I feel like there's such a variety on the shelves. There's
Sure.
mineral, there's zinc, there's, just regular, maybe athletic SPF that's supposed to be more resistant to sweat. I mean, are there certain
Sure.
kinds that you need to look for, or is that branding?
Sure. Well, in healthcare, we often say the best kind of sunscreen is the one you'll wear.
Right.
But there are differences. There are two main types of sunscreen. You mentioned mineral. So the two main minerals are zinc oxide and titanium dioxide, and they work by basically creating a barrier on your skin and reflecting the UV radiation. The chemical sunscreens are usually a combination of chemicals that absorb the UVA and UVB rays. And, a key point on those is that those really do need to be applied about 15 to 30 minutes prior to exposure for them to be effective. So, you can't just put those on and then walk, right out onto the beach. You need to give that a little bit of time to set, so to speak. Um, then the big issue of sprays versus lotions is something that people debate as well. And again, I think the best sunscreen is one that you'll wear. Um, Sprays are super convenient. They do tend to not have as the application is an issue. The coverage is usually not as good as if you're using a lotion. And part of that again is the amount. It takes a lot of the spray to really provide adequate coverage, and most people are just doing a quick pass over each arm and each leg. And if you're out on a windy beach and you're using the spray, a lot of it's heading down the beach. It's not actually contacting your skin, and that's a problem with the sprays as well. So a lot of dermatologists will recommend, a lotion base, get really good coverage. And then if you like the convenience of the spray, take that out onto the beach or the pool or wherever you're going and use that for touch-ups. So.
And I mean, how important is it? We've talked about your body now, but like your eyes, your lips, some of those
Mhm.
things that maybe the average person doesn't think of doing that, of covering that, except for maybe the
Sure.
glare, maybe the glare bugs them. But, how protective is that?
The glare is definitely an issue. Sand, water, snow all really reflect UV radiation, and so you're gonna have more intense exposure in those conditions. The eye protection is very important. You certainly can get skin cancers of the eyelid and around the eye, which are much more difficult to deal with, but also just damage to the eyes themselves, to corneal damage, etc. So from that radiation exposure. So wearing eye protection is really important, and the lips as well. And again, if you get a skin cancer close to or on the lip, more difficult to deal with from a cosmetic perspective than if it's something on the arm or the back. So.
Right. And then, the other thing I wanted to ask too was, we've talked about maybe ways where you can protect yourself from future, skin damage and exposure. But, are there ways to help reverse effects, or is it sort of, you have them now, you just need to be even more careful maybe going forward?
Right. Not really any way to reverse what has already happened, unfortunately. Um, you know, we probably get somewhere between 25 and 50% of our lifetime UV exposure under the age of 20. So, as a parent, being cognizant of, trying to encourage your kids to be diligent about protecting themselves from the sun is important. But the damage that's already occurred can't be reversed. But it is important to protect yourself because, again, it's that cumulative exposure. So it's not only what happened as a child or an adolescent, it's the exposure going forward as well. So very important to continue to protect yourself, even if you've already had a lot of exposure as a child.
And I think for the average person that puts on makeup, there are makeup brands right now that do have sunscreen in them, but and
Hmm.
mine, like let's for example, is 40. But how important is adding
Right.
that extra layer of sunscreen in, underneath that?
Um, so it does help because that day to day use
Hmm.
helps to limit, the exposure that you get just from being outside, even for short periods of time. So it is helpful, certainly. I think, most people obviously think about putting sunscreen on just if they're going to the beach or going to the pool or they know they're going to be outside. But the day-to-day exposure does add up, and particularly if you have a job that takes you outside a lot or, where you have a lot of sun exposure, it is very helpful.
And we talked a little bit about, if you see something, doing a skin check, but for people that maybe have seen something, and maybe don't think it's anything, or maybe people that have actually been diagnosed with skin cancer. I mean, can we talk a little bit about from the patient side? Are there
Sure.
things that they need to expect, or certain treatments that usually, if it is a freckle, that sort of are done to take out that spot from your body?
Well, most skin cancer is treated surgically, so it's removed. Um, I do still encourage patients, even if it's something that they look at and they think, well, this doesn't really look bad to them. A lot of people have in their mind this picture of a melanoma that's, you know, irregular and dark and, just ugly looking to them. And then, so if they see something that's new but doesn't necessarily look like that, that's kind of a false reassurance. If it's new, even if you don't think it's anything, you should have someone look at it. Basal cells usually look like a tiny little red bump to start with. It can have like a shiny or pearly surface. So the most skin cancers are basal cells and squamous cells, and they're not going to look like those classic pictures that we see, online of a mole that has turned into melanoma. So it is important to get it checked. As to the treatment, usually once a biopsy has confirmed the diagnosis, those are treated surgically, and there are a couple of ways to do that. If it is in an area that is difficult to treat surgically, or there's a concern about wound healing, sometimes we will do radiation to treat skin cancers as well. And sometimes we'll do radiation as an adjunct to surgery for a skin cancer that has not been removed until it was more advanced.
And with that, I think a big question that at least I have, that I've know that people ask is, skin cancer, even though it's about your skin, it can't operate like any other cancer, that it unfortunately can spread, and it can become worse. So when we say get it checked out early, I mean, just like any other cancer, right? It could lead to cancer in other areas of the body.
Sure. That is very highly dependent on the type of
Okay.
skin cancer. So a basal cell skin cancer, those rarely spread.
Okay.
They do need to be taken care of, just because the longer you let it go and they have to remove more skin, the cosmetic outcome and the repair is not going to be as optimal. If you take care of it early, that's going to be uh, a better outcome cosmetically. Squamous cells, those can be more aggressive sometimes. And, there are particular types of squamous cell that are more aggressive, and they can spread along the nerves. Sometimes they can spread to lymph nodes. So those are, certainly important to take care of in a timely fashion. And then melanoma is the one that has, a much higher propensity to get into the lymphatic system or the blood and spread to lymph nodes or even distant in the body. So, that's the one that everyone the goal is to prevent that one, definitely. And catch it early, because melanomas that are caught early have, a 99% 5-year survival if they're caught early. So the key is to address it early.
And, the last thing I wanted to mention is, we've talked about reducing your risk of going, outside, particularly in like a higher, time of UV index or sun.
Sure.
But, I've heard of that window where you're supposed to really try to avoid the sun if possible. I believe it's around midday. So
Right.
if you can, is it, staying indoors, maybe going outside for exercise, earlier in the morning or later at night?
Sure. The time of the day, plays a huge role in the amount of UV radiation you're going to be exposed to. The intense part of the day, as you said, right around midday, really 10 to 2 is the most intense. a lot of times in the summer, they'll say 10 to 4, especially on a high UV index day. And, that UV index is calculated using a variety of factors, from anything from cloud cover. It's taking into account the angle of the sun. And what it's really measuring is the intensity of the UV radiation at the surface that we're exposed to. So looking at the UV index, if it's a really high UV index day, maybe trying to do your activities early in the morning or later in the evening is a smart thing to do.
Well, Dr. Stephan, thank you so much.
Of course.
Is there anything else that, I'm sure that we could talk about, much more regarding, individual, cases and so forth, but just
Sure.
for general education purposes, is there anything else that you would just like people to know, going into this summer?
Um, just that there are a lot of factors with skin cancer that we can't really control. You can't control your skin tone. Um, but the one thing that you can control is that exposure. So just to be cognizant of it. And to be aware that, most people are at this point that it's not just skin cancer, also skin aging is highly related to UV exposure as well.